Robbins, author of, well, her new book is Ducks in a Row. And first wanted to talk about like her last book that I've read. I don't have a copy of her new book, but I'm excited to read it. So her first book was Bird's Eye View, Stories of a Life Lived in Healthcare. So I met Sue when she interviewed me, or not interviewed, but met with me as a family support through the Stollery. So she talks about a lot about her son and his journey with his Down syndrome diagnosis, and then my daughter Jana with her diagnosis as well. So she was a big support to me in the beginning. And yeah, I guess I've known you for 15, 16 years.
Yeah, I remember when we first met, was it winter time? I don't know. I remember a cold drive we were meeting in the evening because you were working during the day at that second cup that was by your place. So yeah, I remember us sitting at a table, and it's funny, Ducks in a Row, I talk a lot about meeting with families and other patients, and one of the people that are doing my endorsement, so to write the blurb on the book, read it and said, my gosh, you sure drank a lot of coffee, because I talk a lot about going to coffee shops or going to people's houses, and then of course they offer you coffee, and I realized, yes, that's like a big part of my job at the Stollery.
Yeah.
And it was like, it was awesome. Like I got to meet you, and I got to, what an honor it is to bear witness to somebody else's story, right? And hold that, I think, and that's really special work, I think. And that's in a row. So Ducks in a Row is very much more about change in healthcare. I don't want to say system change, because I kind of given up on that whole thing. Gosh, that's families and patients. We do so much work to try to change the system. And I think part of what I realized by working at two children's hospitals was it's really about us changing ourselves. It's not about that. So I really talk about individual responsibility, about power, how people hold power in healthcare, and about doing what they call patient engagement right, which is all about relationships and getting to know each other as human beings. And I share a lot of stories about what the work that I did at the Stollery, and I have some beautiful anchor ones, I think, that help me grow and learn as we went along. When we first started the Stollery, at the time it was called a Family Centered Care Council, and then I moved here to BC to take a similar job, and so I talk about some of my successes there and also my failures, because I think it's really important. Like, everyone's got lots of ideas to improve healthcare, but I think talking about the barriers that you encounter when you're actually trying to do some change in a hospital environment, whether you're a patient or a staff member, is really, really important, because that's real life. So I talk a lot about the how to do it. And my first book was more about why it's important to put, what I say, more humanity in healthcare, because that's kind of my main message, always about humanity in healthcare. And Ducks in a Row is about actually how to do it.
Gotcha. So it's almost like read the first one first, and then the sequel is putting it into action.
Yeah, I guess it ended up being that way. It was, I try to use a lot of stories, similar as I did in my first book, but I do have a lot more references in this one. Not like this is a definitive book about patient engagement or outreach or humanities in healthcare, because if you want to find out more about specific things, there's a lot of other people who have written about it, who have studied about it. And so it's got a ton of references, kind of as it's kind of a springboard for you to go line up. Like if you want to say improve the waiting room in your clinic, if you're a family doctor and you're reading it, like how do you go about doing that? And I talk about that a bit in the book, but then I have some great references that they can go, if that's the direction that they want to go to find out more. So, but I don't want to say it's not academic. It's still very much me. And I do have like some beautiful stories, like the Stollery story where we had our first Christmas party with the council and how we hosted it at our home, and just that experience of building community together. I think, we kind of, I try to get away from too much data and research. I think healthcare is pretty full of that, and really migrate back to the story piece of it.
Story piece, yeah. And I think that is your power, is like you said, you've got to be witness to a lot of these stories. And so who would be your like target audience or target readers for your Ducks in a Row?
For Ducks in a Row, I would say it's anybody who is not happy with the healthcare system right now, and people who, what I say, pine for change. People who want change, who've been working towards change, who believe in their heart things can be better. And like you said, especially been compounded by the pandemic. I certainly think the pandemic has shown all the cracks. And also, you know, the whole idea about patient and family engagement. And really, you know, when they created those visitor policies, I know they first did them in a time of real crisis, right? Where it was an emergency and they had to do things quickly. But after some time passed, I think they could have reached out to engage caregivers to say what works is, you know, is this working for you? What's not working? Let's take a look at it. Let's create a policy that makes it safe for everybody. And that just didn't happen. It's like they threw patient engagement kind of off the cliff. And I think the reason that happened is because it wasn't that stable to begin with. If it had been truly embedded, it would have been kept, but it wasn't. So now we're back to kind of this control and command way. That's what they went back to. But, you know, it's been 2 years, like you said, like it's time to kind of start like talking to the people. They made so many decisions during the pandemic that have affected people and caused harm and pain to them, that I think it's time to go back and start talking to the people again.
But when you mentioned, you mentioned your target audience is anyone that wants slight change in healthcare. I really think that's everyone.
Yeah, well,
I mean,
if you have encounters with the healthcare system, I think, you're right. And I think people who work in the health system also know that it can be better. And in fact, things are not very good for them right now.
No, exactly.
They're having troubles retaining staff.
Yeah.
Right. Which for very, very good reason is that I think that they're not being listened to and understood either by the people that are making decisions that affect them. So, and I'm trying to break down the idea of us and them. And that's something that's like really important to me, because I think in the past we very much said, here's staff and physicians, here's patients and families.
Right.
And really what I think COVID has shown us is that we're all vulnerable to becoming ill. And so I wish that we could, you know, as patients, we often want to be seen as human beings, right? Like that's something that, like you said, beyond the diagnosis is important, but not just seen as a diagnosis. And that's, I feel, you know, when I had cancer, I was kind of like desperate for that. And I wasn't even seen as a cancer patient. I felt like I was seen as a breast tumor. Like my tumor was the only thing that was actually seen, because cancer is so specialized that they only look at that one little piece of you and nobody looks at the big picture. So, but I think that healthcare professionals also, you know, are harmed by not being seen as people. And really what the system has done to them, they treat them like they're robots and they're just to do tasks, right? And that they're not human beings who are suffering, and certainly in COVID feel moral distress. And I really feel as if they're, you know, that the administrators are not taking the time to take care of their staff, and that's why people are leaving.
Yeah.
So so talking about us together, I think that's the big part of Ducks in a Row. So when I say I wrote it kind of for everybody, that's why.
Yeah.
Anybody who's interested in change. And I'm quite harsh on the whole corporatization of healthcare. And I talk a lot about the power of that, and the fact we, in Canada, which is a publicly funded system, we have CEOs, right? And how they've really adopted that corporate model, and how it harms both staff and patients because of that, because they've drifted away from their reason for being, which is
And if we're all, you know, we're not staff and patients, we're all one big community of humans.
Right. Yeah.
And treating the community and the stresses, if staff are stressed, those humans, that affects everyone.
Of course, yeah.
Maybe it doesn't affect every family individually, but there will be someone in your life that is affected by healthcare for sure.
Yeah, and I think when they talk about staff well-being and patient well-being separately, they're missing the point that, in fact, like you said, they're totally intertwined. So you can't unwind them. Like it's impossible. Like somebody got yelled at in the staff room,
Mm-hmm.
they're not going to walk out and give good, safe patient care after that. Like people are, like I said, they're not robots. They're not like factory workers in the widget factory. And you know, I do talk a lot in the beginning of Ducks in a Row about how this whole quality assurance came from Toyota factory. That's where it came from, right? And about how it was meant to be for safety, having checklists and all, but it's gone too far.
Yeah.
What has happened is that everything is about efficiency
and
pushing people through as quickly as possible, which I'm not even sure the time that we save from pushing everyone through has gone back to patients and staff. Like I don't know what happens to that efficiency. You know what I mean? Like the efficiency, and we still have long wait lists, and I'm not even positive that it works. Like I remember when I was in cancer treatment for my radiation, my first appointment, I came in and you don't know what to expect and you're all totally freaked out, and they have this huge terrible machine they put you under. And I remember the radiation therapist saying to me very specifically, we have 12 minutes. That's how long we have.
Wow.
And so in that, so that means she was telling me I better kind of behave myself and be compliant and get up on the thing and get off the thing and no chit chat. And God forbid I started crying for some reason, they'd have to pause it, right? Like, so it was like, it was very clear to me that, and that's what they were told too. So they had the pressure to push people through 12 minutes. So of course we feel that as patients. And so, and what do you end up losing with that kind of system? It's empathy and compassion, because people are stressed. And now you're right, with the pandemic, it's even worse. So I've been talking about this for so long. I just think there's things that individuals can do to make it better for all of us. And so their decisions, and even if there are harsh rules for good reason, like you said, understanding what emotional effects there are around them, I think is really important. Like my husband went for an appointment at a hospital early in the pandemic. He had to go there. And of course I wasn't allowed in. So I sat and waited outside on the bench, and there were so many, I could say this, just, it seemed like a lot of elderly ladies sitting outside, standing outside, like all worried, worried about their husbands who were in the hospital by themselves. And so I thought, what would it have taken for that hospital? And I'm not talking about running hospitals like hotels, like people have told me that that's what I'm looking. I'm actually not, but like to have a coffee cart out there, like to recognize that, there's caregivers that aren't allowed to go in. That's the way it is. But how can you mitigate that or provide comfort to people in lieu of these really strict rules? And I think that that's something that they forgot. And there was no washroom either. That was the other thing. And I was talking about this with some friends, and people drive from far away. They're in the car a long time to get to these appointments. And then you're not allowed to go into the hospital. And like, what if you have to go to the bathroom? Like, you don't want to go too far. Like, why couldn't they have had like some outhouse, those ones they set up? Like, there's so many of these things that are more than comfort. That's what I think. I think it's about acknowledging that people are going through a hard time and then doing something about it.
Well,
so Ducks in a Row is about that. And I'm so grateful my early readers, a lot, like my intention, they've come back and said it's actually an optimistic book. Although, I do have constructive things to say about all sorts of things, but in the end, the optimism shines through, and that each of us as individuals, I even talk about things like when you're walking down the hall in the hospital, don't have your head, you're an administrator or whatever, right? Don't have your head in the phone. Like, put away your phone, keep your head up, say hello to people in the hall. And people kind of mock me a little bit for being too simple, but it actually starts with that.
Totally.
Right? Yeah, we can do that. You can do that today when you go to work. It's within your, I talk a lot about serenity prayers, right? And what's in your control, what's not in your control.
Yes.
So Ducks in a Row has a lot of ducky ideas, my little ideas that talk about what you can actually do that's in your control.